Okay, give me just 1 second here. Hold on. All right. Good morning, everybody. Thank you for bearing with our technical difficulties. We've had many, and we'll probably continue to encounter many. So we appreciate everybody's patience as we work through this very unique challenge, consistent with what we've been seeing, I think, over the last 11 to 12 months. My name is Akshay Kandawal. I'm from Henry Ford Hospital, and I'm the immediate past chair of the Board of Governors for the American College of Cardiology. And it's my pleasure to welcome you to our inaugural Board of Governors FIT Jeopardy session. Today we have 7 teams that are going to be playing that I will introduce in order. Team number 1 is Howard University from DC. Team number 2 is MedStar University from DC. Team number 3 is Emory University from Georgia. Team number 4 is Augusta from Georgia. Team number 5 is University of Kentucky from Kentucky. Team number 6 is MedStar Kentucky, if I have that correct. And team number 7 is the University of Puerto Rico.
Med Center, Kentucky.
I'm sorry, what was that?
Medical Center, Med Center, Kentucky.
Medical Center, that's team number 6?
Yes, correct.
Okay, my apologies. All right, and just a clarification, we just had an offline conversation. We're talking about the rules for double jeopardy. So there's one double jeopardy that will occur randomly in both single jeopardy as well as double jeopardy. If you have the max that you can wager is either the amount that you have or the maximum value of that on that particular segment on the board. So for example, in single jeopardy, the maximum point value is 400. If you have a negative number, a negative score, or you have less than 400, you can wager up to the maximum value for that for that session, which is the 400, irrespective of whether it was a 200 or 300 or 100 point question. For double jeopardy, the max that you could wager would be 800. If you have a point value that is greater than 400 in single jeopardy or greater than 800 in double jeopardy, you can wager whatever amount up to the value or up to the amount of points that you have. So similar to how regular jeopardy is played, and we can certainly go over the rules at the time when we have a daily double pop up. So I'm going to go to the board now. Okay, and we are going to start with the $100 question. Oh, I just want to very quickly introduce our team. I believe our scorekeeper is Joe Tan, and buzzer control is Saleh Abusin. I also want to just thank the Board of Governors Jeopardy planning team, which is comprised of Dan Philbin, Joe Marine, Kim Marie Chang, Sarah Sears, Mira Arobo, Miriam Surdin, Alice Betts, Kristen West, Liana Colling, and of course, Kechi Ijeoma. Thanks again for participating. And we're going to start with the $100 question because we don't have anybody we have not drawn lots to see who will go first. And Basala, you're going to let me know which team number to call on, right?
Yes.
Oh, and what I'm hearing is, just so that everybody is clear, green is, so the team at the top of the board, you'll see 8 teams. It's ordered 1 through 8, starting with the top row. So green is team 1, which is Howard. Red is team 2, which is MedStar. Dark blue is team 3, which is Emory. Dark purple is team 4, which is Augusta. Yellow is team 5, which is Kentucky. Orange is team 6, which is Kentucky Med Center. and and then the light blue is team 7, which is Puerto Rico. Do I have that correct, Joe?
Yes, and I posted them on the channel chat as well.
Okay, great. Give me 1 second here. All right, so congenitally yours. What is the most common congenital heart disease abnormality in patients with trisomy 21?
Okay, so we have Augusta 4.
So team number 4?
Yes, team number 4.
What is AV canal defects?
That is correct. So I'm going to. What are AV canal defects or endocardial cushion defects? I'm going to go back to the board. That was team number 4, if I'm not mistaken. Team number 4, you have control. Where would you like to go next?
Congenital 400.
Congenitally yours for 400. And you have a daily double. So again, to explain the rules, although you have only 100, not only is this a 400-point question, but you can wager the maximum of the point available on the board, which would be 400. How much would you like to wager?
400.
Okay. So this question is only available for team 4. In patients with surgically repaired tetralogy of Fallot, this ECG finding is a marker of sudden death.
What is QRS more than 180 milliseconds?
That is correct. And these are other risk factors listed here, but you are correct. QRS duration greater than 180 milliseconds. I'm going to go back to the board, and team 4, you retain control. Where would you like to go next?
Crazy rhythm 400.
Crazy rhythms for 400. This channelopathy associated with this ECG is
Again, team 4.
What is CPVT?
that is incorrect, team 4.
Emery, team 3.
Go ahead, team 3.
Yeah. Wrong 57.
That is correct. I'm sorry. Give me 1 second here. That was team 3, correct? Emery?
Yes, that was team
Is that
3.
correct? Okay, thank you, fella. That is correct. Also known as Anderson-Towle syndrome. All right, team 3, you have control of the board.
Congenital yours for 200.
Congenitally yours for 200. A 19-year-old white male presents to the clinic with an abnormal ECG concerning for pre-excitation due to right paraseptal accessory pathway. On exam, he has a pansystolic murmur, which increases on inspiration. His prior cardiologist told him to blame his mother for his heart condition. She may have taken this medication when pregnant.
Team 4.
What is
Augusta.
lithium?
I'm sorry, could you repeat that?
What is lithium?
That is correct, Team 4. So both in an International Registry of Lithium Babies as well as a subsequent New England Journal paper, lithium was found to be associated with Epstein's anomaly, although with a different incidence reported in both studies. Team 4, I will go back to the board, and you have control. Where would you like to go next?
Congenital 300.
We're going to go to congenital. Congenital yours for 300. In this uncorrected congenital heart disease, there is normal oximetry in fingers with cyanosed toes and an absent cardiac murmur.
Team 4.
What is TGA with PDA?
I'm sorry, can you repeat that, please?
What is TGA with PDA?
That's incorrect.
Team 3.
It's sorry, PDA with a cohort.
That's incorrect.
Team 2.
What's a coarctation?
That is incorrect.
Team 7.
Team 7, your response?
We already responded.
All right, I have to.
3 wrong responses, right?
Oh, I see. We stopped at 3 responses. So are we not accepting that? So we're not accepting any answer right or wrong from Team 7. Is that correct?
That would be correct, but you have the final say as well.
Okay, that's fine. That wasn't clear, but we won't penalize Team 7 for that. So, so we've accepted our maximum of 3 responses. Catch, I go to the arrow, correct? Since nobody got this correct?
That is correct.
All right. So we were asking for a very specific answer, PDA with isomengurization, which obviously leads to not only this condition, but the absent murmur. So I'm going to go back to the board, and I'll need some help from Joe or Salah, who had control of the board. Was it Team 3 or 4?
4.
Team 4, where would you like to go next?
Crazy Rhythm 300.
Crazy Rhythms for 300. So the picture on the left is going to be the picture with the condition. The picture on the right is after resolution of this condition. What is this condition and what is the likely cause of this in a 73-year-old man with prior history of ischemic cardiomyopathy, diagnosed 15 years ago, status post-ICD? So once again, before I start the time limit, the picture on the left is with the condition, the picture on the right is with the condition resolved.
Team 4.
What is SVC syndrome?
That is incorrect.
Team 2.
What is SVC obstruction from ICD lead?
That is incorrect.
Team 6.
That was Team 2, I'm sorry, right?
Correct.
So Team 6 is next.
Team 6.
What is hemochromatosis?
That is incorrect, Team 6. And we've hit our capacity of 3 responses for this question. So we're going to move on to the answer. What we were looking for is argyria, or blue man syndrome from amiodarone. resulting in a silver or bluish discoloration of the skin. So we will go back to the board. I believe it was team 4 that had control, right?
Correct.
Team 4, where would you like to go next?
Valvular heart disease 400.
Valvular heart disease for 400. A 65-year-old woman with severe aortic stenosis presents to the clinic. She is physically active and asymptomatic. Per the 2020 ACC AHA guidelines, intervention is recommended for asymptomatic severe aortic stenosis at low surgical risk with very severe aortic stenosis, Vmax greater than 5 meters per second, comma, decreasing exercise tolerance, progression of Vmax greater than 3 meters per second per year, exercise-associated decrease in systolic blood pressure greater than this amount, or serum BNP greater than this factor of normal.
Team 3?
No responses?
No, team 3?
10 millimeters mercury and 3 times normal.
Team 3, that is correct. So per the latest 2020 guidelines, both of those answers are correct, and the guidelines are presented here. All right, Team 3, you are now in charge of the board. Where would you like to go next?
Crazy rhythm for 100.
Crazy rhythms for 100. The rhythm on this ECG is
Team 1?
Morbid type 1, sinus rhythm with Morbid 1. No,
Team 1, that's incorrect.
no.
What did you say?
Team 5?
What is third degree heart block?
Yes, that is correct. Team 5, so what is complete heart block or third degree heart block? Team 5, you've got control of the board. Where would you like to go?
Bleeding for 100.
Bleeding for 100. Ivradibine is the FDA approved for this patient population. And I'm going to ask that we are specific on the answer.
Team 4?
Systolic heart failure with EF less than 40% who have a heart rate greater than 70 beats per minute on maximally sinus rhythm on maximally tolerated beta blocker doses.
Well, that is correct. That was Team 4. Is that right?
Yes.
So I think this is the exact answer that we were looking for, and that is correct. You got at least one of the two specified responses we were looking for. Heart failure with sinus rhythm, resting heart rate greater than 70 on maximum tolerated beta blocker. I'm going to go back to the board. Team 4, where are we going?
400 at the heart of all problems.
400 at the heart of all problems. The indication to operate on aortic aneurysms in patients with Loic Deep syndrome is?
Team 6?
What is 4.5 centimeters?
That is incorrect. That was Team 6,
Yes,
right?
that was Team 6. Team 5?
What is 4?
That is incorrect.
Team 4?
What is 5 centimeters?
Unfortunately, that is incorrect as well, and we've hit our 3 maximally allowed responses. So it's a very specific answer: aortic diameter greater than 4.2 centimeters by TEE, internal diameter, or 4.4 to greater than 4.6 centimeters by CT and or MR, external diameter. Would have accepted either one of those as correct. We'll go back to the board, and I believe Team 4 has control still.
400 bleeding.
400 bleeding. The AV block seen on this tracing is
So we have team 1.
Second
Team
degree
1.
type 1.
That is
Second degree type
incorrect,
1.
team 1. That is incorrect.
And I don't have any other person after that.
No other responses?
No other
Okay.
responses.
The answer for this was also complete heart block with PVCs or EAD. I'm going to go back to the board, but give me 1 second. I think team 4 has control, but I'm understanding that we're having some connection difficulties with Puerto Rico.
So we have time for one more
All right,
question. Gandula, Abhishek.
We're back
Okay.
again. We have the internet connection.
We're here now.
Okay, so we're going to do one more question for this round. Team 4, you have control.
Hey, would you mind resetting our buzzer? Our buzzer still says buzz. Thank you. So crazy rhythm.
Thank you for pointing that out. Go ahead, crazy rhythm for 200.
Yes.
All right, 23-year-old white lady with POTS and inappropriate sinus tachycardia is resistant to all lifestyle and behavioral changes. You initiate pharmacotherapy with ivradimine 5 milligrams BID. The mechanism of action of this medication is?
Team 4.
What is funny sodium channel inhibition?
That is correct. I would have asked you to be more specific, but that is correct. All right, so I'm going to go back to the board, but that was, for sake of time, that was our last question for single Jeopardy round. Is that correct?
Correct.
Salah, are we moving to double Jeopardy now?
Yes.
Oh, we're going to take
So
a
actually we
10-minute
have a
break.
10-minute break, right?
Yeah, we have a 10-minute break. So let's the participants, you can do your powwow, and we will restart the game at 8:36 Central Time. That's 9:36 a.m. Central at Eastern Time. So you guys can strategize, and then we'll restart at 9:36 a.m. Eastern. Salah, you can take control.
Okay. So do you want me to do the audience question now?
That is correct.
Okay, all right. Got it.
So the audience, there's a question for you. If you want to put your answers in the chat box, Salah is going to run that for you. And there's a prize that we're offering to the first correct answer for the audience.
Okay, so hopefully you're seeing my screen. Is that right? Oh, actually, no. Let's stop that.
Hey guys, can we switch buzzers?
We're trying to switch from our phones to a laptop to see if that changes rapidity.
Yeah, absolutely. You can switch your buzzers.
All right, thanks.
Okay, can you see my screen now?
Yes, we can.
Okay, so this question is for the audience. So I think we have attendees here, right? So the audience members should submit their answers in the chat box. the first correct answer will win a $30 Amazon gift card. Okay, so this is a question for the audience for round one. Administration of this class of drug caused the change seen from the black loop to the red loop. Okay, so, all right, so we did get a few answers here. And I think, so what is a beta-1 agonist? Beta-1 agonists such as dobutamine would produce a positive inotropic effect, which would increase stroke volume and reduce the end systolic volume in the LV. So I think positive inotrope is okay, but I think dobutamine is the specific answer. So Atif Tatari would be our winner for the audience question.
Well, thank you, Dr. Tatari. If you want to send me your email, we will send you a gift card via email. Salah, I think you may want to test the buzzer for DC MedStar if they have reset it during the break.
Okay, do you want to, are you ready now? DC MedStar, or is that the group who wanted to test it?
Correct.
Okay, so try now.
So we're switching locations. Can you give us 2 minutes?
Yeah, sure, yeah, that's fine.
Thanks.
Can you check our buzzer too, team 1, please?
Okay, go ahead.
7, please. We had to log out and re-log back in.
Yeah, so why don't we just do it all at once, and then I'll count down like we did earlier. Okay, is DC MedStar ready or not yet? Okay, we can test the other people.
We need a quick second. We're almost ready. Yeah, okay. We're just sitting. Okay, we can test it again now.
Okay, so I'm going to count down again. I'll count up. So 1, 2, 3.
Okay, I mean, there was like a second delay, 1 or 2 second delay.
Yeah. So 5, 2, 3, 7, 6. So who was the other group who wanted to test?
Team 1.
For us, it's gray.
It's still gray for us.
Yeah, team 1, I don't see you yet. Are you ready? Do you want to try it again?
Yes, we are.
Okay, so I'm going to count again. I'm going to count to 3. 1, 2, 3.
No.
Yeah. Okay, we probably will like switch to another connection. Let's see.
Yeah, your buzzer's not working.
Yeah, let us switch to another connection. We are ready now. Can we try one more time?
Okay, so then 1, 2, 3.
Worked for us.
Okay. All right, so who are we testing here? Howard, right? 1?
Team 1, yes.
Yeah, it worked fine. Okay, is everybody okay with their buzzer so far? Does anyone want to test theirs, or is everyone okay? Okay.
All right. Ketchy, are you still on the line?
Yes.
Okay. Separately, a question about one of the responses has come up, which I am uncertain on how to respond. A team was awarded negative points for what they believe is a correct answer. Do we have a way to adjudicate this?
Yes. What was the question? Sorry.
So this is, I'm just thinking, is there a way that I can, are you in the chat box real quick? I don't see your name. You're not a participant. Can I chat with you very quickly through the chat box?
This should be discussed.
I think we should discuss about
Here.
this a lot.
I'm sorry, what was that?
Can we discuss it as a group? Is this about the Lowy Dietz question?
Yeah, give me 1 second here. Let me just give Ketchy the background, and then let me just discuss this offline real quick with Ketchy, and then I'll come back to the group. So just give me 2 minutes here. All right, I think what we'll do is Ketchy and I will continue to try and discuss this. I think rather than discussing as a group, I think that's going to be unproductive. It's an unusual situation. We're living in a sort of a digital era of presenting this virtually. So she and I will consult necessary people, and we'll make any adjustments towards the end of Double Jeopardy if that's required. Fela, I'm also going to ask you to make sure, just because we have a couple of negative scores on the board, to give people an ample opportunity to correct those scores. Let me know when we have time for 3 questions before we have to move to final round. So because we are time limited, and that's why I want to get started, we will have to end Double Jeopardy perhaps a little bit earlier, and we may not be able to get through all the questions. So do let me know when we have time for 3 final questions before moving to Final Jeopardy.
Okay, so I was told 8:55, or 55 minutes from the start. Do you want to make it 50 minutes?
No, the 50. I mean, just at 50 minutes, just tell me that, or just let me know that I'm not paying attention to the time. So just let me know when we have. Just let me know when we have 5 minutes left, and I'll probably say 3 or 4 questions. Okay.
Okay. Dr.
So these are the.
Sorry, Dr. Kandawal. So we have a hard stop at 9. Sorry, I'm in Central Time. So it's 8:41 right now. We have to stop at 9:30 my time. So that will be 10:30 your time. So we have enough time to do all the questions on the Double Jeopardy board.
Oh, that's helpful.
Yeah.
Okay.
Yeah, because the hard stop is in an hour from, about roughly 40 minutes from now. So we can do all the questions in Double Jeopardy.
Okay. Fair enough. So in the meantime, let me know if we have an adjudication on the concern that was brought up, and I appreciate everybody's patience on this. So we've got 5 categories with 4-point values in each category. This is Double Jeopardy, so the point values are double, and we'll give you a final warning it sounds like we'll be able to complete all the questions before going to Final Jeopardy. As a reminder, you do need to have a positive score in order to play Final Jeopardy, just like the actual Jeopardy rules. We will start with the team that has the lowest point total for control of the board. That would be Team 6. And one last thing, we have problems with, there may be 2 challenges with the audio on cardiac auscultation. Ketchy, I'm just going to go ahead and use moderator's prerogative and throw those questions out for the sake of moving on with the competition. So 400 and 800 on cardiac auscultation, we will skip, just so that there are no audio issues with those that are playing online. So 400 and 800 under cardiac auscultation, we will not play those questions, but Team 6, you have control of the board. Where would you like to go?
We do not see the board.
Oh, I'm sorry. Hold on. I can fix that.
You can see it now.
Okay. Give me 1 second. Hold on. Okay, Team 6, go ahead. Where would you like to go?
Amazing angios for 200.
Amazing angios for 200. This diagnosis does not usually lead to ischemia on stress testing.
Team 2.
What is myocardial bridging?
That is correct. What is myocardial bridging? That was the blanching that you saw in the proximate LED. I'm sorry. I hit the wrong button. I'm gonna apologetically gonna have to throw that question out. I apologize. That was the 400 for amazing angio, so I apologize. Team 2.
Which one?
Where would you like to go next?
Angios for 800.
I'm sorry, what was that for 800?
Angio's 800, please.
Angio's 800. The diagnosis seen on angiography in this patient with heart failure.
Team 1.
Non-compaction cardiomyopathy.
That is correct. Left ventricular non-compaction or spongy myocardium. All right, that was team 1, if I'm not mistaken, correct?
Yes.
All right, you have control of the board.
Cardiac auscultation 200.
In mitral valve prolapse, this maneuver will cause the mid-systolic click to move towards F2 and shorten the duration of the mitral regurgitation murmur.
Team 2.
Let's see. What is squat?
That is correct,
No.
team 2.
No, sorry. We're playing Jeopardy and someone said CPVT is correct. Is that correct? Yeah?
Ketchy, are
I
you
will let
on
them know
mute?
that that's correct, okay? We're doing Jeopardy for ACC right now.
Sorry about that. So front squatting is correct. That was team 2. Team 2, you have control of the board.
Yeah. Okay, just 6. Right? Yeah, we'll do angios for 600.
The diagnosis is shown by the angiogram here.
Team 4.
What is mitral regurgitation? Severe MR.
Team 4, that's incorrect.
Team 3.
It is, what is an aneurysm of the sinus of Valsalva?
Team 3, that is incorrect.
Team 2.
What is VSD?
That was team 2.
Team 2.
Yeah.
That is correct. So there's a ventricular septal defect. This is an LAO LV angiogram, so you can see contrast going into the RV. Give me 1 second. I'm going to go back to the board for 1 second and give me 1 second, team 2, before telling me your category. 1 second. Okay, team 2, sorry, apologize for that delay. Go ahead, you have control of the board.
We'll do Renton's Revenge for 200.
Röntgen's Revenge for 200. The diagnosis suggested by X-ray in this patient with heart failure.
Team 6.
What is constricted pericarditis?
Team 6, that is correct. Constrictive pericarditis is evidenced by the calcification seen on X-ray. Team 6, I'm going to go back to the board, and you have control.
Rankin's Revenge for 400.
Röntgen's Revenge for 400. This diagnosis is suggested by the chest X-ray.
Team 6.
What is coarctation of the aorta?
That is correct. We're having a little bit of an echo, Team 6, when you respond. If there's a way that maybe you can turn down perhaps either your volume or one of your mics. You probably have two devices on, but that is correct, Team 6. What is coarctation of the aorta? I'm going to go back to the board. Where would you like to go next?
Rankin's revenge for 600.
The diagnosis in this 6-year-old female with dyspnea.
Team 1.
What is Shimita syndrome?
Team 1, that is correct. That is the answer that we were looking for. I'm going to go back to the board, and you have control.
Ron, blame the folks 200.
Blame the folks for 200. I'm going to let all the echoes play before asking for the answer, but the specified diagnosis shown by the echocardiogram is
Team 4.
What is ventricular septal defect?
Team 4, that's incorrect. Or can you be more specific?
What is membranous VSD?
I'm sorry, that's not the answer we were looking for.
Okay, Team 3.
Outflow VSD.
I'm sorry, which team was that?
That was Team 3.
Team 3, I'm sorry, that's incorrect as well. Team 3.
Team 6.
What is perimembranous VSD?
Team 6, I'm sorry, that's incorrect as well. Those are our three answers. So those are our three responses. So I'll go to the answer. The specific diagnosis we were looking for based on the echocardiogram is tetralogy of Fallot. And so based on the unrestricted VSD, which most people got, but also the overriding aorta, I think is evidence for tetralogy. I'm going to go back to the board, and I'll be honest, I have lost a little bit of track of who had control. Was that Team 2? Team 1? Okay, my apologies. Okay.
Blame the folks 400.
Blame the folks for 400. Just a note to all the panelists, or a note to all the teams, as well as to anyone who's attending the presentation. I'm just seeing a couple of answers popping up in the chat box. If it's discussion after the answer, that's one thing, but let's make sure that we're not inadvertently providing answers to the team. I'm sure it was done all in for the purposes of contributing to education, but let's just make sure that we're not providing any answers, correct or incorrect, too early to the teams. I'm sorry, Team 1, where were you going? Blame the folks, you said?
Yes, blame the folks 400.
So the most likely diagnosis in this patient with wide fixed splitting of F2.
Team 4.
What is secondum ASD?
Team 4, that is incorrect.
Team 5.
Whole-Oren syndrome.
I'm sorry, what was that again?
Holt-Oram syndrome.
I don't believe that that is the correct response on that. Actually, it's not the correct response. I'm sorry.
Okay.
What team was that? I'm sorry.
That was team 5.
Team 5.
Team 1.
Anyone?
Primum ASD.
That is the correct answer that we were looking for. That's the most likely diagnosis with the left axis deviation, the QRS configuration, and evidence of RV strain. Team 1, I'm going to go back to the board. Also, before we go too much further in the game, there is a correction to the score that I'm going to make. There was an ECG that was displayed during single Jeopardy that we were asking for the channelopathy, and Team 4 Augusta responded with CPVT, and we've gotten confirmation that that is that we will accept that as the correct response. A team subsequently responded with a different correct response after that. We're not going to deduct points. That's been decided by the judges involved in the in Jeopardy, but we will go ahead and adjust Augusta with 400 points, a differential of 400. So in other words, we took off 400, we'll credit that back, and then we'll give 400 for the correct answer. So the net difference is 800. Ketchy, am I correct with that?
That is correct. Hey, can we?
So I'm going to go to.
Can we challenge that? CPVT is not a channelopathy.
CPVT is a channelopathy.
Yeah. So for the purposes of discussion, we've already adjudicated that with an expert, and that's going to be our final decision on that. Thank you for your input. Kenji, can you tell me how to adjust the score?
Yeah,
Is it
so
right
you
here?
click on adjust. Yes.
Okay, and this is team 4. We're going to go to minus 800, right?
Yeah, you're adding 800 back to them. Yes.
Correct. So I'm good.
You're very good.
All right. Where are we going next?
Blame the folks for 600.
Blame the folks for 600. The cause of dyspnea in the patient with the echocardiogram here. I'm going to let them all play before we accept responses.
Team 6.
What is core triatriatum?
Team 6, that is correct. What is core triatriatum? I'm going to go back to the board, and you have control.
I forgot to mention that we 55 minutes from when we started. We're 58 now. So.
And Ketchy has given us the clearance to continue on. Our hard stop is 10:30, so 10:30 Eastern Standard Time. But thank you for that.
Excuse me, I think we're having trouble with our buzzer. I never turned red on that last question. I'm not sure if we can log out and log back in with the buzzer.
So you want to change your buzzer? You want a 2-minute break to do that?
If we can do that, that'd be great.
Okay, we have time.
Just a
switch your
minute.
buzzer.
Yeah, so I turned all buzzers off, and then we can do a test if you want before we continue. So which team was that who had problem with the buzzer? I missed that.
Team number 7.
Okay, so tell us when you're ready so we can test it for you.
All right, I think we're ready. I think, can we try it out?
Okay, yeah, so I'm gonna count to 3. 1, 2, 3. Yeah, it came.
All right, great.
Yeah.
Thank you.
All right, are we ready to proceed then?
Yes.
Okay. Where are we going next?
Rankin's Revenge for 800.
For 800. And this is a daily double. And I'm sorry, what team was that? I apologize.
Team 6.
Team 6. So this is a daily double. You have 300, but you are able to wager up to 800 as the maximum point value on this round. What would you like to wager?
300.
The specific diagnosis shown is the cause of hypotension in this patient.
What is pneumopericardium?
That is correct, Team 6. Pneumopericardium. I'm going to go back to the board. And Team 6, you've got control.
Blame the folks for 800.
Blame the folks for 800. The specific abnormality shown by the echocardiogram here is, I'm going to let them all play.
Team 2.
This parachute mitral valve.
Team 2, that is correct. And I'm going to go back to the board. Team 2, where would you like to go?
Okay, we'll do EKG for 200.
EKG for 200. The specific findings shown on this ECG is
Team 6.
What is an atrial echo beat?
That is correct, Team 6. Those are atrial echo beats. I'm going to go back to the board. Where would you like to go next, Team 6?
EKG enigmas for 400.
For 400. The most likely diagnosis in this 39-year-old male with syncope.
Team 6.
What is type 1 Brugada syndrome?
That is correct, Team 6. We would have accepted Brugada syndrome, but type 1 is correct. I'm going to go back to the board for Team 6. And just as a reminder, we're throwing out the amazing angios for 400, cardiac auscultation for 400, and cardiac auscultation for 800. So there are 3 questions left. Where would you like to go, Team 6?
EKG enigmas for 600.
For 600. The most likely diagnosis in this 60-year-old male 2 weeks post-MI.
Team 5.
Oh,
how did they beat us?
LV aneurysm.
Team 5, that is correct. What is an LV aneurysm? You've taken control of the board. And where would you like to go next, Team 5?
Auscultation for 6.
Auscultation for 600. This is our second daily double. Team 5 that you have minus 100, but you're able to wager up to 800 as the maximum point value for this round. How much would you like to wager?
400, please.
400. So this is only available for Team 5. This specific auscultatory interval is inversely related to the severity of mitral stenosis.
No answer.
Time to opening snap.
Yes, we'll accept that. That was Team 5. Time to opening snap. Team 5 will go back to the board. And there is only one question left. I'm going to click that for us. The most likely drug leading to this arrhythmia.
Team 5.
What is digitalis?
That is correct, Team 5. So I'm going to go back to the board. We've completed all the acceptable questions. Team 1 has 1,300. Team 2 has 1,200. Unfortunately, Team 3 with 300 and Team 4 with 800 are unable to participate in Final Jeopardy because of negative scores. Team 5, 1,100, and Team 6, 1,200. I'm going to go ahead and go into Final Jeopardy. So the category is go with the flow. What I'm going to ask is for all teams to go to the chat box in the Zoom, to go to the Zoom chat box in the to panel. Please make sure that you select my name, Akshay Kandawal, and I'm going to ask you to tell me your team name and your wager. Remember, you can only wager money that you have. We're not the government. You can't wager money that you don't have. So team 1, 2, 4, and 5. And I'm sorry, I didn't mention, but Team 7 did not have any points and cannot proceed to Final Jeopardy either. I'm sorry. But Team 1, 2, 4, and 5, if you can please chat me privately your wager, I will enter those into.
That would be
so I have
1,
Team
2, 5, and 6.
1, 2, 5, and 6. That is correct. So I have wagers from 1. I have wagers from 2. I have wagers from 6, and I'm just waiting for the wager from 5. And I have them all. Give me 1 second. Okay, and then the way this is going to work is I'm going to give the answer. You will, again, keep me in the chat box, keep my name addressed in your chat box. That way you send me the answer and I will go through once time is allotted, and we will go one by one through each team. All right, everyone understand that? Everybody good? So make sure that you've kept me selected in your chat box and I will record your answer. And just a reminder to audience and other participants, please do not place any answer or suggestions in the chat box. All right, the specific finding demonstrated by echocardiography, and there'll be a video clip in this patient status post LVAD, specifically a HeartMate 2 device. Ketchy, am I going to reveal response or am I going to the arrow?
You go for the arrow.
I'm going to go to the arrow here. All right, the specific finding demonstrated by echocardiography in this patient status post LVAD HeartMate 2 device. Okay, great. I will give 5 more seconds for an answer to pop into the chat box. I'm not seeing anything yet, except from a couple of teams. Okay, and the answers are now closed. Ketchy, I'm going to the arrow again, is that correct?
No, you go to the backward arrow.
Backward arrow.
Mm-hmm.
And then reveal response?
That is correct.
All right, so I'm going to go to real response. These were the answers that we would have accepted: a suck down effect, or high RPM, or septal contact with the LVAD, or malposition of the LVAD. I'm going to go with the team with the lowest total, which was team 5 at 1100. Team 5 put down suction event, which we will accept. The next lowest were teams 2 and team 6. Team 6 responded suction, which we will accept. Team 2 answered suction event, which we will accept. And team 1 responded RV overload, which we cannot accept as the correct response. So these are the final scores. Team 1 ends up with 100, team 2, 2,400. I think congratulations, team 2 from DC. Team 3, 2,100, and team 4, 2,400. So congratulations, or I'm sorry, team 5, 2,100, team 6, 2,400. So congratulations, Kentucky Med Center. Salah, Joe, or Ketchy, anything else?
No, thank you to all the teams. It was you guys played very well, and I thank you for going through all the technical challenges that we had. For the DC chapter, the team 2 will proceed to ACC 21, so we'll be sending your name to ACC 21, team 2. For the Georgia chapter teams, team 3 will be going to ACC 21. So we'll be sending your name to ACC 21, team 3. Congratulations for Georgia. For Kentucky teams, team 6 will be going to ACC 21 Jeopardy. So send your name. Puerto Rico, you are automatically qualified for ACC 21. So we'll also send your team name as well. Thanks to everyone.
Thank you guys, appreciate it.
Thanks, everyone.
Thank you.
Akshay, okay.